Hello. Hello, hello, hello. Hello, hello. This is not a very good time to present, but I'll go for it. After lunch, everybody start getting ready to get out of here. It's okay.
No, but we want to hear what you have to say.
Okay, so like she said, my name is Ngozi. I already go by Ngozi. That's my Nigerian name, Ngozi IIouno. I'm both a women's health and family practitioner in Los Angeles. I'm in process of getting my doctorate in psychiatry. I'm an epidemiologist too. My PhD is in epidemiology. I'm going to talk about association between cervical cancer screening and socio-demographic characteristics of Hispanic women in the United States. I have no disclosures to make, other than I'm partial towards women and children issues. Those are my only disclosures. So it's actually outline, not overview. My outline, I have the overview, global disease perspective, the global disease burden in the United States, the risk factors of cervical cancer among Hispanic women, study findings, application, and recommendations. So Hispanic women actually have the highest incident rate of cervical cancer in the United States and the second highest mortality rate in the US. African American women have the highest mortality rate. Actually, minority women are greatly affected by cervical cancer in the US. And the reason is what we're going to talk about. But I'm going to focus on the social demographic factors that affect screening for cervical cancer. So what is cervical cancer? Cervical cancer is the cancer that affects the neck of the uterus. That's the cervix. They call it neck or the womb, uterus of the womb. So that's the tube-shaped area of the uterus. And it is one of the most curable cancers in the world. It's treatable, it's curable, it's done, but unfortunately, poor screening can result in developing the cancer and mortality. Cervical cancer screening in the US is done through pap smear, Papa Nicolau, and it's still the gold standard for screening for cervical cancer. Pap smear identified all the abnormalities that could lead to precancerous lesions and cervical cancer ultimately. And there are several abnormalities that could result. It could be what we call the ASCAS, or the low grade, or the high grade, or the glandular cells, too many of them. But human papillomavirus, which is one of the most sexual, it's actually not one, it's actually the most sexually transmitted disease in the world, anywhere in the world, in the US, anywhere. HPV is number one. Has been identified as one of the causes, actually the 80% of the causes in cervical cancer cases. It's sexually transmitted, but unfortunately, there is no signs and symptoms when you have it. The only way you can identify cervical HPV is through pap smear. And for the males, it's through anal pap, which is not too popular in certain communities, but I'll go into that later. Okay, so cervical cancer actually does not have any cost, nothing. You don't have any research have done, or tons of researches. There is no identifiable cause of cervical cancer. However, there are predisposing factors or risk factors of cervical cancer. And I'm going to just mention a few and then talk about one or a couple of them. We'll have a low socioeconomic status, which is linked to nutrient deficiency, linked to poor hygiene, and linked to multiple sexual partners. Some of these women, due to poor finances, engage in sexual promiscuity with several partners, and that is a precursor for HPV infection. So they contract this HPV, and they don't even know they have it. And if they don't get screened, then you can have precancerous lesion and ultimately cervical cancer. There's also genetic factors. There are high smoking, tobacco usage, and then oral contraceptives, and also, of course, the virus factors like HPV and HIV. So what is this human papillomavirus? There are several strains, about 100 strains of this virus. But for cervical cancer, we're only going to focus, the ones that have been identified in testing are factors 16, 18, 31, and 45. Those are regarded as high-risk HPVs. And there are the low-risk ones, which are like 6, 11, 5, 10, 20, several numbers. And those ones can cause genital warts, enogenital warts, oral warts, and skin warts. But for the purpose of this presentation, we're focusing on the one that causes cervical cancer, which are the high-risk ones of 16, 18, 31, and 45. So what are the global disease burden of this disease? It's staggering in African, both in Eastern and Middle Africa. Malawi, to be precise, has the highest number. It's staggering because there are no treatment. There are no screening done. By the time the women get to the hospital, they'll actually have the disease. So you're trying to treat cancer, and which they don't have those the facilities to take care of these things, and then ultimate death. But you can see even in the United States and Western Europe, there's still some numbers there. In the US, it's about 2.4% in 100,000 women, the mortality. But in Africa as a whole is pretty frightening. So the disease burden again in the US, you can see the incidence rate is pretty high among Hispanic women. Age-related incident rates, 9.7%. Then the next is African American women and the rest of the race. So, and this is why I'm actually very interested in this, because this is a preventable disease. Something could be done to stop it if you can screen, but then women are still dying of it. I mean, given that in the last 5 years, there's been an increase in screening, but still Hispanic women are still behind. They still have the low rate of screening for this disease. So despite all the screening centers available, all the testing and everything, we still have 225.8 million women that are still not screened, according to CDC in the last few years. So it's still very frightening for this disease. For me, it's curable, it could be prevented, but people are still not getting treated for it, screened or treated for it. So what are the benefits of screening? So about 10 years ago, we used to do pap smear every year, but in the last 6 to 7 years, I think it's health plan issues. They now say 3 to 5 years. Some health plan would tell you 3, Kaiser would tell you 5. So now, even I don't agree with that, because I said cancer never tells you when it's gonna come, but that's what they're going with. So, but if every woman that's supposed to be screened is screened within 3 to 5 years, there could be a reduction, and up to 83% of cervical cancer cases could be prevented in the US, 83%. So I'm saying if 100 people are screened, 94 of them will be free of cervical cancer. The other 6 will have to struggle with it. So it's very important that we get the word out there, tell your sister, everybody you know about this screening. It's actually free. I mean, I'm from California, it's free. My clinic will actually give women $50 for each time they come for their pap smear screening. We give them money, we bus them, send Uber, bring them. This is how much, because medicine now has gone to preventive medicine. That's what we're doing now. Nobody's doing treating nothing, we want to prevent. The government is giving health plans tons of millions of dollars if you achieve a certain percentage of prevention. So every year we'll have a scale that we use, the graph. If you attain certain percentage, they'll give you a whole lot of money. So we're pushing a lot, but still, the minority are still hard hit by this disease. So despite the availability of this, everything that we're talking about, there are vaccines. Because like I was talking to one of my colleagues about when the presenter from Uganda was talking about, I said, all you need to do is for just a flight to come to the United States, and then we'll have a vaccine for it. So there are vaccines for HPV vaccines. In 2 of them, Gardasil and Cervarix. In the US, we use Gardasil. In Europe, we use Cervarix, 3 doses. When the vaccine was first manufactured several years ago, it was for boys and girls between ages 9 and 26. But now, it's up to 45 years now. So if you know anyone, it's 3 doses. The insurance health plans are paying for it. The vaccination has been extended to 45 years. The Gardasil, 3 doses of it. And if every woman that's supposed to be, I was just reading something online recently, somebody sent me. If every woman that's supposed to be vaccinated does vaccinate, get the vaccines, it's going to reduce it by 83%. So it's pretty, these vaccines have been tested, they have been researched upon, and they are very effective. But the point, initially when it came up, people were so scared with it, so it's going to make girls promiscuous, because that's what mothers are telling the clinic. He's trying to make my child to remember that if she has sex, she's going to have this. So you're going to remind her. We don't remind teenagers about sex. They'll tell you about sex. So I told the mom, I said, look, talk to your daughter. She actually knows about sex than you think she knows. So the best thing is to equip her, immunize her with these things and prepare her just in case something happens. Don't tell me I'm telling her about sex. She knows more. Ask her now. Leave the room and see what she's going to say. So we need to embrace the reality of our time. We need to really get the message out there, because some of those things that we believed in that happened years ago is no longer obtainable these days. So all those scary stuff of vaccines, do this and that and all that. Let's push it out there. Gardasil 3 doses is going to reduce the incidence of curable disease by 83%. You can't get anything better than that. And the health plans are paying for it. So why not? So the method that was used, I actually used a secondary data from the National Health Interview Survey in 3 years, 2011, 2013, and 2012. And I actually focused on Hispanic women ages 21 to 65. 21 because before 10 years ago, anyone who is sexually active, even if you're 13 years of age, gets a pap smear. But now it has to be 21 to get a pap smear, which again, I don't agree with that. Because it's better you start screening before they get this much exposure, But now that's why my research was from 21 years, because that's what the government is saying now. You can't, no pap smear under 21. Even if you have a baby, no pap smear. Yeah, I know. So I use both the logistic regression and chi-square. How did I get to this? What happened?
Just go up there to resume slideshow.
It's working on mine. It's working on this one. It's good. So chi-square and logistic regression were used to ascertain the social demographic characteristics versus compliance for cervical cancer screening. So my independent variables that I used were educational level, family income, and marital status. So you can see the sample size was obtained. It was 2,065 women. The confidence interval was 95%. And you can see across the board in all 3 years, we got at 739 women. And the error of margin was 0.05 across the board. My results, the age distribution, like I said, 21 to 39. We didn't have a lot of them in the survey. Most of them was between ages 30 to 65. That's why you have the mean age of 39 years. Then chi-square, you can see age, income, marital status, educational level were used, and you can see on the p-value there was no significance in the p-value. So we're like, okay, so let's go to logistic regression. We used logistic regression. We found out that educational level was significant in all 3 years, but family income and marital status were constant. So educational level, because the higher the education a woman has, the more likely the woman wants to take care of themselves. The more likely they want to have the screening done. So most of the problems we had were the ones who are 0 to grade 6 level. Literacy, once again, has a lot to do with this. Literacy is a big deal among the Hispanic women who are doing this. I have to rush through this, I'm sorry, because I'm being rushed. So my conclusion that there was no statistically significant association between family income, marital status, on the screening rates for Hispanic women in the United States. However, education was a predictor for cervical cancer screening. The higher the level of education, the more likely they're going to go for screening. So what do? So the recommendation is to massive, extensive education. I say from elementary school, from high school, we need to talk to all the governmental, all the insurance, healthcare, health plans. I think they are doing something now. Like I said, in the clinic where I work, if you have a pap smear done, we'll give you $50 gift certificate. We'll send Uber to pick you up, send Uber to drop you off, all that stuff. It's really massive, you know. So if we can piggyback on that and focus on the minorities mainly, because it's access to health that is the problem for the most part. Most of the people that live in the rural area, and what we call country in the U.S., the access to health is pretty limited. So if we can go with all this, all of us, tell 2 people, tell 3 people, you guys, people that have grandsons, granddaughters from age 9, talk about this vaccination, very important. Don't say, oh, you're going to remind them of, just like any other vaccination, 3 doses. You protect them. Even the ones who are already active, once they're under 45, the health plan pays for them to get this vaccination.
For boys as well. Right?
Boys and girls. Boys and girls, yes. Boys and girls. Because actually, boys are the ones that actually carry these things. You have sex to get it, you know. And unfortunately, for the girls, you do pap smear until 21 years old. But the boys who did IIouno pap, I don't know, show of hand, all the men here, if I say, let me do IIouno pap, and you're going to let me do that, they say, oh, no, I don't want that. That's not wrong with me. So it's still a problem. I mean, most of the guys that come through, even the ones that usually it's actually the gay men that really want to do it because they want to know. Because there's a lot of anogenital warts and laryngeal warts, and these are caused by HPV. So they will let you do the IIouno pap. But an average heterosexual man in the clinic, when they come for physical analysis, you want to do IIouno? No, I don't want to do no IIouno pap. What do you want to do? What do you want to do? I say, okay, don't worry about it. You know. So it's always the case. The women get screened. But then if your partner has it and you get screened, you're still going to have to get it. So and that is why I don't agree with pap smear every 3 to 5 years, because you never know. And we've got a lot of abnormal paps. Somebody that came for pap smear, then the next time she comes, she has abnormal paps. So it's just still a big problem. But I think all this is bordered on money. You know, the insurance company don't want to pay for it and all kinds of things. So hopefully, you know, we'll get to headway on that one. Thank you very much.